Hello, my name is Kevin, and it is March 24th, 2012. On November 18th of 2011, I was diagnosed with a terminal, untreatable, incurable illness, a neuromuscular illness called ALS, or Lou Gehrig's disease as it's commonly known. And the purpose of this video is to talk about the diagnosis process that I went through and what some of my symptoms have been. Back in 2010, I would say around August of 2010, I began to get a sense that something was different about my workouts. I typically worked out about 3 times a week in the gym, lifting weights and doing aerobic exercise, stretching, etc. I also used to work out twice a week, riding my bike around a lake near my house, 10 to 15 miles a time, and walking once or twice a week, 5 miles a time. And so I was in pretty good shape, and have been most of my life. Back in August, in hindsight, of course, I didn't realize it at the time, I was noticing that my workouts weren't producing the same effect on my body that they had before. I was, typically I would work out, I'd do a good workout, get tired, rest the next day, and then the second day I would feel very energetic and very strong. And what was happening was, and it was pretty subtle at first, the second day I was no longer feeling that extra surge of energy, that extra strength. I was no longer feeling good. I was feeling just a little bit fatigued. Now, I'm 54 years old, and I kind of attributed that to getting older. I figured, oh well, I'm getting older, and that must be why I'm feeling differently. On November 18th of 2010, I got out of bed in the middle of the night to go to the bathroom, as I often had done before, and I lost my balance and fell and hit my head on the door jamb. Great shot, by the way. Bled all over the place. Ended up going to the hospital and getting 7 or 8 stitches to close the wound. And of course that was not the interesting issue. The issue wasn't the injury, because anybody falling and hitting their heads like that would have the same injury. The issue was why I lost my balance and fell. I cannot to this day, well, I cannot to this day tell you why that occurred. Anyway, I believe that was my first significant indication of a problem that eventually has been identified as ALS. Ironically, one year to the day of my ALS diagnosis. And they say, if you look at the reading, that it takes on the average about a full year to diagnose this illness. Anyway, that was in November of 2010. Now, of course, at that time, I had no idea what was happening, but I had some more symptoms come up pretty quickly thereafter. The first symptom was my right shoulder was getting significantly weaker and had some pain in it. So I figured I had damaged my right shoulder somehow, even though I had no idea how I might have damaged it. And I started taking care of it as I normally would over the years, by icing it initially and then putting heat on it, taking ibuprofen to drop any swelling that might be in the joint, changing and altering my workouts. And this went on for several months, and to make a long story short, it just continued to get weaker no matter what I did. It continued to get weaker. that weakness then started proceeding down my arm into my bicep and tricep. And being a weightlifter, I knew exactly how much weaker I was getting because I knew how much weight I had been lifting before and how much weight I had been lifting after. And there were significant differences occurring, 50% or more of a weight drop, which is very, very significant. So that kind of continued for a little while. I was really beginning to get seriously concerned when one day I woke up and I was limping. I was sort of dragging my right leg as I walked, and I had no idea why I was limping. I was not in pain. I didn't have any kind of an injury. And I, for the life of me, could not figure out why I was limping. So I said, wow, okay, this is now getting serious. I have this problem that seemingly was affecting the right side of my body. I had all kinds of thoughts of brain cancer and everything else. So I made an appointment to see my doctor. I made that appointment in June. It took a couple of months, so it was August before I got to see him. And in between making that appointment and going to the appointment, I had a couple of additional symptoms occur. The first was muscle twitching, which is an interesting little phenomenon. You might see here that my muscles here are twitching right now. I wore this shirt specifically so that this could be seen on film. I have no control over this. This is twitching muscles, and at the time the only muscles that were really twitching were in my shoulder here, but they were twitching pretty significantly. And actually, when I was in the doctor's office, normally when you go into the doctor's office the thing doesn't happen, but in this particular case he was able to witness my twitching. Anyway, so this twitching continues unabated. The other one was muscle cramping, which anyone who's alive pretty much knows what a muscle cramp feels like. Any athletes would know that sometimes they can be fairly painful depending on where they are, etc. These cramps were typically in my calf muscles initially, but they were life-stopping cramps where I had to stop everything I was doing and grab my foot and yank it back to stretch my calf muscle, and everything else stopped until that cramp was taken care of. Anyway, those cramps had started happening with some regularity, say, once a day, every day. I was cramping like that. And so by the time I had got to the doctor for my annual physical / discussion of these issues, I presented him with my listing of issues. And, he didn't really know what to make of it. As a matter of fact, he said on muscle twitching that I needed to relax. He thought maybe stress was causing the muscle twitching. Of course, the cramping he couldn't see or, objectively observe. So he told me, drinking some Gatorade might help with that. The limping, what could he say? I mean, he thought maybe I had a slight injury. I just wasn't aware of any pain or anything. And the weakness in the shoulder, he thought maybe I did have some shoulder damage. However, with all of those things and one additional brand new one, which I had no awareness of, and that is what he called brisk reflexes. He went to test my reflexes where, you get the little hammer and you hit the knee. And man, when he hit my knee, my leg went up, my foot went way up in the air, and I jumped practically out of the chair, almost knocked him over. He said, "Whoa, you got some brisk reflexes there." And so he had tested several other reflexes on my body, and all of them were incredibly brisk. Anyway, he didn't know what to do with me, but he thought, let's do some blood testing, the regular stuff you do with a physical, and then in addition, let's do a brain MRI. And I sort of figured if anything was going to kill me, it would be my brain. So I figured, okay, we'll just go through the process and see what comes out. Anyway, everything was clean. Blood work clean, the stool sample clean, everything clean. I'm as clean as can be. I'm in great health. Heart's in great health. Lungs are great. brain MRI comes out incredibly clean. So he basically says to me, I don't know what to do with you. So he decided that I should go and see a neurologist, which ended up taking more than a month, 5 or 6 weeks to see a neurologist. Anyway, during that time, I had a problem with my lower back as far as, a little bit of back pain, which is unrelated because I had some back arthritis before and it flared up every once in a while. Anyway, that combined with the limping, I thought, I'm going to go to a chiropractor. So I went to a chiropractor, and actually I was very impressed with this guy. He put me through about a 1-hour process of trying to diagnose, various issues in my body, and he did different muscle tests and balancing tests and everything else. And, he came back in with a little chart, and I went to him several times. It did help my lower back, although no matter what he did, it didn't affect my limp. My limp continued, and my pain in my and my weakness, pain's not the right word, weakness in my right shoulder continued. At the end of the day, he suggested I go see a neurologist. He thought I might have some neuromuscular problem and suggested I see a neurologist. Anyway, I finally did see the neurologist. I went through my list of stuff with him, and he suggested 2 things. He said, okay, let's take an MRI of the C-spine, which is your upper spinal area, basically your neck, and let's have you go off of all supplements, which I had taken a lot, vitamins, minerals, protein powders, etc. He said, go off of everything for a month, and let's see if this could be a chemically induced problem. So I did that. I went off of everything for a month. I did the C-spine MRI. After a month, my symptoms were worse, not better, and so obviously it had nothing to do with any of the supplements I was taking. And the C-spine MRI showed a little bit of damage, not uncommon for my age, and but nothing that would account for my symptoms. So on November 18th of 2011, 1 year to the day after I fell and cracked my head open, I was put through a nerve conduction study, which was very interesting. It basically, he put electrical contacts in different parts of my body. He did my whole body and then ran electric current through there, took measurements, put them into a computer program, and lo and behold, he sat me down. He said, Kevin, based on all of your symptoms and the results of the nerve conduction study, I believe you have ALS. And I looked at him and I said, Doctor, that's the worst thing you could have said to me. Now, an ALS diagnosis is a clinical diagnosis, which means there's no objective and definitive test that they can take, like a blood test, and, oh yeah, here, you got ALS. ALS is diagnosed after everything else is eliminated. So after he told me what he thought he had, he said, let's do some additional testing and eliminate other possibilities. I said, great. So let's see, we did extensive blood tests, including heavy metal poisoning testing, which came out clean. We did a spinal tap, which involves putting a needle into your spine and sucking out the fluid and then analyzing the fluid. Not a lot of fun, by the way, but wasn't nearly as bad as I thought it was going to be. It's, the guy did a great job, relatively painless, more scary than anything. But the spinal fluid came out very clean. We did a CT scan of my kidneys because there is apparently a kidney illness that mimics ALS symptoms. And so I went in and did that test, and that came back very clean. So the bottom line is that I'm an incredibly healthy individual in wonderful, incredible shape for my age, with one exception, and that is that I have this mysterious illness that no one knows where it comes from, no one knows what causes it, no one knows how to treat it, and no one knows how to make it go away. That's kind of where we're at. So anyway, since November 18th of 2011 through March 24th of 2012, there has been sort of a linear downward progression of my symptoms. I don't see, so far I haven't seen any speeding up or any slowing down or any backing off or anything like that. It just seems to be sort of slowly inching downhill. At this point I'm walking with a cane. It's getting very, very difficult even to walk with a cane. I think I'll probably, if things progress much further, I'll be on a walker here soon. My right shoulder is so weak now that I can almost not lift my arm. It's almost impossible for me to lift my arm above my shoulder at this point. It's, I sort of have to help it with my other arm. The twitching continues, the cramping continues. I have a lot of muscle atrophy. I've lost 40 pounds. I'm 6'2". I used to weigh 250 pounds. And, although some of that was probably excess weight, most of it was pretty solid. And now I have a skinny little shoulder here, and, skinny little arm, and super skinny little forearm. I don't know if you can see that. And my right hand now is pretty much useless. I can barely straighten my fingers if I really, I can't straighten my fingers. I can almost straighten them if I really work at it. I certainly can stretch them. My right thumb, this muscle in here, I don't know if you can see it on the film or not, but it's not there anymore. I mean, this used to be a lump going upwards with strength, and now it's just sort of an indentation here. There's the muscle there stopped working. And these muscles in here, which control the fingers, are not working either. So since the muscle's not working, it's basically dying away. Very frustrating. Very, very frustrating process. Another symptom I hadn't mentioned that is interesting is my muscles at different times have had a feeling of being numb. And I use the word numb because I can't think of another word to use. It's not numb as in if you touch your finger to your skin, you can't feel it. I can feel my skin. My skin is fine. Absolutely working 100%. All my touch is okay. But it's like there's a numbness in the muscle. And the same numbness that I was feeling over in my right arm several months ago, which then went into my hand, which then led to the muscle loss, I'm now feeling in my left arm and my left hand. And that's pretty scary. I got to tell you, that's pretty scary. I would say that, and you can see I'm wearing this belt. This is a sort of a kind of a weightlifter's belt. What it does is I'm finding that I have so much compensation going on of, if I go to lift my shoulder muscle is no longer doing the work. These muscles up here have to do the work. I have to tighten my torso. This over here is, so my torso is constantly twisting and reaching for things, and it's getting very tired and very sore. And so I find that by wearing this belt, it helps my situation a little bit. Anyway, I'm sure I've forgotten something, but that's pretty much how this was diagnosed. Took a year, and it was a difficult process, very costly process in our medical, medical situation here in the U.S. And at the end of the day, they told me what I have, but they can't really do anything about it. So anyway, there goes look at my bicep now. It's really popping away. More later.